All right. Hello, everybody, and I hope this video will be very helpful for you. This month, I'm going to talk about how to help somebody enroll into Medicare Part B when they are retiring. So, this is for somebody who already has Medicare Part A coming off of their group insurance and needing to enroll into Medicare Part B. So there's a couple of forms that you need, and they're very easy to Google. My advice is to print these forms out and hand them to your clients, or at least send them this link so they can do it. But the number one thing to look for is something called a CMS 40B. This is a request for Medicare Part B. And if you just Google it, it's just cms.gov with this long URL. My advice is just to Google CMS 40B. As you scroll down, there's lots of different versions. You can download it in English, you can download it in Spanish. Just to kind of give you guys an idea of what it looks like, we'll click on it. Um, the form is really simple. You simply just put your Medicare number because this person already has Medicare Part A. You put the last name, first name, middle, initial, address, city, state, zip code, phone number. Do you wish to sign up for Part B? Yes. And then, do you currently have coverage through an employer or union or health plan, group health plan? That is yes. Are you currently an international volunteer for nonprofit organization? Yes or no, just depends on what your situation is. And then enter the dates of employment and health coverage below. And then under this remarks section, would you want to, and well, number 8, this section says, has an employer required you to enroll into Part B? Most of the time that is no, but I guess occasionally that could be a yes, just so you'll understand that. But under the remarks section, what I typically do is just request, write something like requesting, and let's see, we'll say September 1, 2025 effective date. Something like this, whenever you want it to begin. Typically, the timeline to do this is about 60 days prior to somebody needing it, but it doesn't have to be 60 days. It just, within 60 days is helpful, but you can also do it the month that you need it to begin. So if this was middle of August and somebody needed to apply for Medicare Part B, you can also fill out this form and just write, I need a September 1st effective date. And then the person signs it and dates it. So these are some instructions about doing Medicare Part, how to fill this form out. These are really helpful, but I just wanted to give you a quick synopsis on how to do that. The other form that you need is something called an L564. CMS L564 is what keeps people from having penalties. So this is a request for employment information. And on this form, what you're going to do is the same thing. You're going to Google CMS L564, but this form needs to be completed by an employer. So the employee can do a little bit of it. The employee can do their name or the employer's name, the employer's address, those kinds of things. But I usually just leave this to the employer, so someone's company. And then they can go ahead and put in the company name, the date, the employer's address. Now, the applicant's name and employee's name, this can be a little bit tricky for spouses. So if I'm the employee, my name is going to go here twice. I'm the applicant and I'm the employee, and I'm going to put my social security number twice. However, if I'm a spouse, the applicant is the spouse with the spouse's social security number, and then the employee goes right here. Under the applicant name, they would only do this if the spouse was covered under the employee's insurance, obviously. If an individual had insurance under their own company's plan, then they would obviously do their form with their company. So this is based on whose insurance that you are on, either your own or your spouse's. But somebody who's applying for Medicare Part B needs to have that CMS 40B form, then also this L564 form, because the employer is going to come in here and enter all of this information. Was the applicant covered under the health plan? Yes. Has the coverage ended? Yes or no? They're going to fill out all of this, and then they're going to sign it, date it, and then put their title and then their phone number. So These two forms, the CMS 40B and the CMS L564, are two forms that you need to have completed to give to Social Security in order to apply for Medicare Part B um, when you're coming off of group insurance. If you get these two forms completed, what I always recommend doing is faxing it to your local Social Security office. If you don't know where the local Social Security office is for your client, you can go to ssa.gov, scroll down to the very bottom, and then find an office, and then put in a zip code under locate an office by zip code. And we just put in 35226. That's my zip code. And then this will give you the fax number for the local office. And the reason I like to send it to the local office is because it's being processed locally. And sometimes those offices are, can be kind of small, and so they can process things rather quickly. Um, Sometimes they're large, but somebody, in the local office is doing it. It's not going, somewhere out into the internet where somebody not in that state is processing it. Um, so just a suggestion. There's one other way that you can apply for Part B, and I'm going to show you that in just a second. But what we typically do in our office is we do a 40B. We give them the L564 so they can get it to their employer. And then we suggest faxing these two forms to the local Social Security office with a cover letter. We have a fax machine in our office. We're happy to fax it for people. If you don't have access to fax, there's other ways you can do this. This is just kind of the way we do it in our office. All right. So if we wanted to apply for Social Security I'm sorry, if we wanted to apply for Medicare Part B without doing those forms, then you basically go to ssa.gov, you sign up for Medicare, you scroll down just a little ways, and you want to sign up for Part B only. So this is the same thing that we were just doing. This is just not needing those two forms specifically and faxing them. On this, you'll just click Get Started and then start an application. Now, the difference in this is that you're really using those two forms, except they've just put it on their website. Um, they're got some disclaimers here. Let's go ahead and say yes, start application. And you will see these two forms that we're filling out look basically identical to we did this form that we're filling out here online looks identical to what we were doing before. So as you just scroll down and look through this, it gives you all the information. And that you need, and you basically just continue to fill out all this information like you did before for each individual person. It's just not those two forms and faxing them in. The only biggest difference between these two things is this is not going to your employer and having the employer fill this out. So sometimes people don't want their employer to know that they're leaving work. So we do it this way. We just apply online. This also can sometimes be easier for people to do it this way. But the biggest difference is that you have to attach some kind of documentation that shows that you've had employer coverage. And as you go through here, I'm not going to read every single things to you on this, but there's a list of things that are good enough to show that you've had group insurance. So just you want to read through all of these and make sure that you upload something that is significantly, something significant that shows that you've had it, that your client has had employer coverage. And there's two different things that you can attach, and then they sign it here. This signature can be a little bit tricky for people who are not very internet savvy, because once you sign it and submit it, then an email will go to their inbox. They have to click on that email to signify that that's who they are. So there's a little bit more steps, I think, to this, only because you have to attach some documents, click signature here, then check your email and just do some extra steps. If your client is very internet savvy, they could easily do this. But if they are not, these two PDF forms, in my opinion, are just really simple. And then just a simple fax to a local office. When it goes to this, when you do it online, it goes to a department within Social Security called the Workload Support Unit, which is perfectly fine. It's just a kind of a unit that doesn't answer calls very often, and it's sort of, the only way you're really going to communicate with the people who are processing it is through, calling the Social Security office. They can view it, but nobody inside the Social Security office can do anything with it because the application is sitting with the workload support unit. So only somebody within that department can touch it. But either way, if you've got plenty of time and you've got, 30 to 60 days to help somebody enroll, doing it online this way is very simple to do, but also doing these two PDFs also really simple to do. So I hope that was helpful. The topic again is just how to help somebody apply for Medicare Part B when they're coming off of group insurance. You got a form basically saying, "Hey, I'm requesting Medicare Part B," and another form simply saying, "I've had group insurance." Doing it online is basically the same thing, except you're not sending anything to an employer. You're uploading proof that you've had employer coverage. So anyway, hope you guys are doing well, and hopefully this was helpful. Talk to you all soon. Bye bye.